My name is Morgan Anderson. I'm an inpatient therapist in the Laureate Eating Disorder Program, part of the St. Francis Health System here in Tulsa, Oklahoma. I'm here today to answer some common questions and to raise awareness about eating disorders, an illness that impacts so many people across the country. The first question I have here is, what are eating disorders? Eating disorders are an illness revolved around food, where when a person's relationship with food becomes problematic, it might impact their relationships, their finances, it can impact their mental health, it can impact how they engage and interact with others, and really draws them out of their life. So my next question here is, what are the different types of eating disorders? There's basically four main categories of eating disorder. One is anorexia nervosa, which is characterized by restricting intake, also severe body image distress. So the restriction of intake is driven by a drive to be thinner, to change the shape or size of one's body. The next one is bulimia nervosa, which is a pattern of binge eating, which is eating large quantities of foods in a short amount of time, and then purging, vomiting, laxative use, excessive exercise, and that's also driven by often a desire to change the way one looks, the way one sees or perceives their body. Binge eating disorder, which is characterized again by eating large quantities of food in a short amount of time without the compensation that bulimia has. It's purely the binge action of the eating disorder. There is that weight component part of it as well, where there's the body image distress. The last eating disorder, avoidant restrictive intake disorder, which is whenever somebody avoids foods because of textures or fears of adversive consequences, like I'm afraid if I eat this that I might choke. And this eating disorder is not driven by a desire to be thin or to lose weight. Often actually people with this eating disorder want to gain weight, they want to restore weight, but they're afraid of the food, so that's what gets in the way. What are the warning signs of an eating disorder? So some of the things that might indicate an eating disorder for yourself or a loved one is if there's a lot of body checking going on. The person walks by mirrors, they're looking at themselves, or pinching their body to do kind of body checking and seeing if their body has changed, noticing some of those things. Hiding food, if you have a child or a loved one who you find food in their room, might be a sign that they're having some shame around their relationship with food. Fixation on weight, more frequent talks about weight, seems to be obsessive around food and calories, and a lot of conversations around food. If you notice your loved one going to the restroom quickly after meals, or that they have to go to the gym and exercise every time after they eat, can be some of the indications that their relationship with food has become really distressing. It could be if you notice changes in mood or affect for your loved one. So if you notice that normally they're a happy-go-lucky kid and now they're really irritable, they're really frustrated, they don't want to spend as much time with friends, those are kind of things that you can look for as well. Eating disorders as well do not discriminate around age. Often they're associated with adolescence and early adulthood because there's a lot of body changes that happen during puberty, peer pressure, those kinds of things. But really in our program, we have seen and treated women from adolescence all the way through older adulthood, 60, 70 plus. Yeah, so another warning sign would be changes in performance. If you notice that you're having a hard time focusing at work, showing up, being present, or if your loved one starts struggling with keeping up with grades academically, those types of things can be another warning sign that maybe there's something more going on. Another thing to look for would be self-talk, the way your loved one is talking about themselves. If they seem to be making a lot of negative comments about themselves, really down on themselves, that might be a sign that an eating disorder could be present as well, especially if they're making comments about their body shape or size, or just themselves as a person. How can I support my loved one if they have an eating disorder? I think it's really important to be direct, honest, and compassionate. If you have concerns about their behaviors, that they're sliding bring this to their awareness. I'm really concerned about you. I noticed this going on. It's okay to speak from your heart, but also to use facts. I saw this, I noticed this, as well as talking about that piece of you that really cares about them. I really care about you. I'm really concerned. And to do it in a non-judgmental way. Often there can be shame around the eating disorder. The person might want to keep it hidden or might be embarrassed that somebody noticed what they were doing. And so being sure to tell them, hey, I don't judge you for this. I care about you, and so I'm here to support you. If you're going out and you notice a lot of diet talk going on and there's people around talking about their new diets they're on, helping change the subject. Hey, cool, did you see that new movie? It was really awesome. And just doing some things like that and being aware that some of those conversations are probably really hard on the loved one in your life who has an eating disorder. What are some of the factors that might influence an eating disorder? We operate from the biopsychosocial model of eating disorder development. There's some biological components to eating disorders, genetics play a role, the psychological side of it, things like just temperament can play a role, as well as the social aspect. So that can involve upbringing, it can involve trauma history, it can involve exposure to social media and other societal pressures that kind of push or perpetuate certain stigmas around certain body types. So those things can all really kind of play a role in the development of eating disorders. What I do want to say is, as a profession, we're really moving away from blaming caregivers as being responsible. So if your loved one has an eating disorder, oftentimes it's common to feel guilt. What did I do? How did I influence this? And really it's important to step back and know that it's no one thing caused it, no one person caused it. Family can be one of the most important pieces of healing from an eating disorder. So if you suspect that you or a loved one has an eating disorder, please know that you are not alone. There are resources out there to help. A great first step is to reach out to your primary care physician and talk about your concerns. At the Laureate Eating Disorder Program, we offer inpatient as well as outpatient counseling services, as well as dietitian services and psychiatric services to those who suffer from eating disorders. There are also national services available, such as the National Eating Disorder Association, NEDA. Down below, links will be provided for additional resources to help you seek the care you need or to answer any additional questions that you might have. Thank you so much for watching this video. I hope that it's been informative and has answered some of your questions. Please know that the path to recovery is possible and that there are people out there who want to help you live a happy, healthy life.